VOMS in our clinic is a key piece of our evaluation for a concussion patient. It gives us a good basic understanding of what's going on ocular-motor, vestibular, and it helps us to formulate an initial treatment plan with the patient and give them something to start with at home. It's important after the VOMS test to reassess the patient for symptoms. Oftentimes they're very symptomatic, and I will have them rest until their symptoms return closer to baseline. Once that test is complete, then we can decide whether we're going to continue on with more assessment or we're going to wait for the future to do more testing. First thing we're going to do is we're going to get a baseline test on some similar or common symptoms that we're going to see, which is going to be dizziness, headache, nausea, and fogginess. Okay, so we're going to get a number out of 10 on 0 to 10, and I want to get a baseline on all of those. So we're going to test smooth pursuits. That's the ability of your eyes to follow an object along a pathway. You're going to stare straight at me. Your eyes are the only thing that's going to be moving. So we're going to follow from here, point A to point B, and just track my finger as it moves along. And what we're watching for is any eye movement that is dysfunctional. Okay, now you're going to give me a repeat on your symptoms. For each one of these, when you're recording symptoms, after you do the test, you want to wait about 10 seconds before you ask them their change in symptoms. Did anything change with your headache?
No.
Okay. Any dizziness right now?
Yes.
Give me a number.
4.
Any nausea?
Yes.
Give me a number out of 0 to 10.
4.
Fogginess?
No.
The next we're going to track, they're called saccades. That's your ability of your eye to jump from one object to another and stay in focus. Okay, so your head again is not going to move. You're going to jump from my finger to the next. We're going to repeat this 10 times. Okay, so you're going to go from here to here. And stop. Okay. After 10 times, we're going to give me a number on see if there's anything changing in your symptoms. Any dizziness, any headache, any change in fogginess or nausea. With the saccadic eye movement, we're looking for faulty movement patterns. So what we're looking for is are your eyes jumping from one target to the next smoothly, or are we seeing a corrective saccade at the end? So next we're going to do the vertical saccades. So your head is going to stay steady. You're going to start jumping from top to bottom, and we're going to repeat this 10 times. I will tell you when to stop. Okay, 1. Okay, and stop. And again, I will note any faulty eye movement pattern. Okay, next we're going to do, it's called convergence. What you are going to do is you're going to hold the stick out in front of you like this, and you're going to see an X on here. It's 14-point font. You're going to slowly bring it towards the tip of your nose, like you're going to touch that X on the tip of your nose. You're going to stop as soon as you see double vision, when you see 2 X's, or when I tell you to stop. What I'm looking for is for the eyes to either converge, or are they both following all the way to the target, okay? All the way out in front of you. You're going to slowly bring that to your nose, and you're going to stop when you see 2 X's. Okay? And then note the distance. And we're going to repeat 2 more times. Then we're going to test for, you can rest, you can hand me that, any change in your symptoms. Next, we're going to do the VOR, which is a test for your ability to maintain your eyes and your fixation on an object while your head is moving. Okay, so for this one, we're going to use a metronome at 180 beats per minute. Your eyes are going to stay fixated on my nose as your head turns from side to side at 20 degrees left to right. It's going to be at a very fast pace, and I want you to try and keep up with it. So we're going to start the metronome now. And rest. And we repeat it 10 times, and then we're going to note his change in symptoms. Next, we're going to check vertical. That was horizontal, now we're going to do vertical. Same thing, your eyes are going to stay fixated on my nose. Your head is going to go at the same pace, up and down, while your eyes stay fixated on my nose. We're going to repeat this 10 times, then we're going to check your symptoms, okay? We're going to start the metronome. And rest. Next thing we're going to test is visual motion sensitivity, or VR cancellation. It is your eye's ability to stop movement when your vestibular system is working. Okay, so what you're going to do is you're going to hold your thumbs, both thumbs out just like this in front of you. You're going to rotate your whole body together as a unit while fixating on your thumbs. You're going to go 80 degrees to the left and then 80 degrees to the right at the beat of a 50-beat metronome, like that. Okay, we're going to go 5 repetitions and we're going to stop and retest your symptoms. So we're going to start the test now. You're going to hold your thumbs out in front of you just like this. Your eyes are going to stay fixated on your thumbs as you move. You're going to go left to right and we're going to do 5 repetitions. Have your head and whole body follow each other as they go along. Okay, and go. And rest.